I am Dr. Ravindra B Kamble, lead consultant in Department of Radiology, Aster RV Hospital, JP Nagar. I am going to talk about the indications and contraindications of the CT angiogram. So CT angiography is a form of CT scan where we inject intravenous contrast into the body, and at the same time we acquire CT scan in different phases. That it is the plain scan, then we do it in the arterial phase, the venous phase, and the late venous phase. So in this manner, we can look at the arteries of the brain or the body, the venous system, and the delayed venous system. So we get good information about the arteries and the veins of the body. If we are doing CT angiography of the brain, then we can understand about the carotid arteries and the circle of Willis or the arteries of the brain. If we are doing CT angiography of the lower limb, we can understand about the arteries of the lower limb like femoral arteries, popliteal artery, and the below knee tibial arteries. So before doing a CT angiogram, we have to do a creatinine, which is mandatory for any patient when we give contrast in the CT scan. So if the creatinine is normal, we can go ahead with the CT angiography. So what are the indications we do for the CT angiography? We do CT angiography whenever we suspect some sort of bleed. For example, in the brain, if there is a bleeding into the brain, we do CT angiography to detect why there is a bleeding into the brain, which may be due to either rupture of the aneurysm or because of the AV malformation. CT angiography can also be done in patient who comes with a stroke to detect if there is any blockage of the blood vessels, or CT angiography of the lower limb can be done if there is some sort of blockage or the claudication, what we call, or necrosis of the toes, especially in patients who has peripheral vascular disease. We ask for a CT angiography of the lower limb. So otherwise, CT angiography gives us a good information about the arteries and the veins of the body and is relatively safe, except for patients who has a high creatinine or in the pediatric patients where there can be an increase in the radiation dose.